Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and today is January 8th, 2021. This is our first report of the year 2021, so hopefully this year goes a little bit better than last. As always, we'll start with our COVID-19 statistics. Worldwide, we've got nearly 90 million cases and over 1.9 million deaths. In the United States, we have over 22 million cases and nearly 380,000 deaths. This past week, for the first time, the United States experienced a day of over 4,000 deaths, and then it happened again. So multiple days this past week of over 4,000 deaths. I hate to start the new year with bad news, but it is what it is. We've talked a lot about, in the past couple of weeks, we've talked a lot about the new SARS-CoV-2 variant, B.1.1.7. We've mentioned that although symptoms aren't any more severe, it does seem to transmit more easily between people. We also pointed out that even though it seems to have started in the UK, it has now been seen or been discovered or found in many places, including the United States. Despite the danger the new variant poses, the current vaccines should still work, and following the CDC guidelines of wearing a mask, watching your distance, and washing your hands will also slow or eliminate the spread of the B.1.1.7 variant. We also mentioned in the past, just very briefly, that South Africa had a variant that was similar to B.1.1.7. This week we learned a little bit more about that variant, and that's where some more bad news comes in. This variant is known as 501v2. It has similar mutations to B.1.1.7, which makes it able to transmit between people easier. But it also has additional mutations in the spike protein. The spike protein is the part of the virus that lets it enter the cell. Basically, in order to wreak any havoc on our bodies, it has to enter the cells first. So spike protein is a pretty important part, and all our available vaccines right now are based around the idea of stopping that spike protein. So at this point, we're all relying on that. We need that spike protein to stay that same way. Currently, however, scientists are worried that the 501v2 variant may have changed its spike protein enough to make current vaccines less effective, not completely ineffective. They think that the vaccines will still work partially against it. For example, we may get the COVID-19 still, even though we've been vaccinated, if it is that specific variant. But we wouldn't show as bad symptoms, for example. So it would still be important to get that vaccine, even if the 501v2 variant does show up in the United States. And it's also important to realize that as of right now, the main variant throughout the world is still the one that the vaccines were specifically made for. So vaccines are still very important. Everybody should be getting them as soon as they're available for you. There's really no reason not to get the vaccine. So the more people that get the vaccines, the less likely it is that people will get any variant of the COVID-19 virus, and that will help it to stop mutating. We'll discuss mutations a little bit later in our program here, but just know that we really do need to get those vaccines. It's been a little bit slow putting out the vaccines in the United States and around the world, and there have been a few different options floated for getting more vaccines out. I've got links to those articles about that down below the video. We won't talk about it too much today, but those links are definitely down below the video. So going back to this variant 501v2, even just a couple weeks ago, scientists were of the opinion that the virus, the SARS-CoV-2, which causes COVID-19, that it would probably take quite a bit longer, or might not even happen at all, that the virus would mutate the spike protein parts of it enough to evade the vaccines. Now they're thinking it's a much more likely possibility because they've discovered this 501v2 variant. Currently, the 501v2 variant has only been found in South Africa, where it seems to have originated, a couple of other African countries, and a few European and Asian countries. It's probably in other places too, possibly even the United States, but it just hasn't been detected yet. Even with the bad news about this variant, though, we don't need to panic. Following the CDC guidelines will still work. All these guidelines that we've been mentioning time and time again, the washing the hands, the wearing the face mask, the watching your distance, avoiding large crowds, all those kind of things, they work against any type of disease pretty much. If it's virus, bacteria, even to some degree parasitical, any of those, these kind of precautions help. So it doesn't matter if we've got different variants and stuff. Even if they evade the vaccines, we can still do these other things and keep the COVID-19 from spreading. That's why it's so important. So please, we need to do this. Also, a bit of good news, scientists are saying that even if our current vaccines are not very effective against the 501v2 variant, or even if it became even worse later on with a bigger mutation, it would only take about 4 to 6 weeks in order to modify the current vaccines to work with the different spike protein. The spike protein part apparently is pretty easy to work with, and that's one of the big reasons why these vaccines were done so much more quickly than vaccines in the past. I know a lot of people are not trusting these vaccines because of how quickly they were done, but it's because of the specific way that they tried to do them. So we don't have to worry about that. Another thing is that there are other vaccines currently being worked on. Some are in the testing phase, some are still being created. But these other vaccines are vaccines that don't focus on the spike protein. They focus on other parts of the virus. And so, with all these different vaccines, coming up here, hopefully not too long in the future, we'll have a multi-pronged attack against SARS-CoV-2. And with that multi-pronged attack, we should be able to get rid of it without too much trouble. But like I said, following those CDC guidelines is extremely important right now, as it has been the whole entire time we've had this pandemic going on. So let's talk a little bit about mutations. How do mutations happen? Why are we seeing some mutations in some places and other places don't seem to be having very many mutations? So first off, the basics. In order to reproduce, viruses will just make a copy of themselves. They basically take over a cell, cause that cell to pump out copies of the virus. Anytime they try to make a copy, though, there's always a chance for mistakes. And those mistakes, they could go in a few different ways. Most commonly, the mistakes are such that it just causes the virus to die right there. That specific copy of the virus just dies. Nothing happens except for that one copy of the virus dies. That's usually the most common, actually. Second most common usually is that it just doesn't make a big enough difference, doesn't really matter. It's just a tiny, tiny difference that doesn't actually make any change in how the virus actually works. And so we don't really see any change as far as effect on humans. Third possibility is that it makes a change that doesn't kill it right away, but it makes it less effective, and so it eventually dies out. That happens sometimes, not as often as we'd like it to, but it does happen. And the fourth possibility, the one that we really don't like, is that it mutates in such a way that makes it more effective, either more effective at spreading, more effective at causing serious symptoms, more effective at becoming resistant to specific medications or vaccines, things like that. And so those kind of things would make a virus live longer. And the longer a virus lives, the more it can actually spread, the more it can reproduce. And so the more likely it'll be that that's the copy that gets transmitted to other people just because it's living longer and reproducing more. So over time, those mutated viruses will gather more mutations. They'll keep mutating after time over time. And so we'll start getting worse and worse types of mutations, worse and worse types of variants. I say worse For us, usually, for the virus, it always tries to go better for itself. And so, without any interventions, viruses could very easily cause problems for us. Thankfully, our bodies have immune systems that are fairly effective, actually, at fighting viruses. And it just takes a little while, and then our immune systems get used to the virus, and they figure out ways to defeat it. Also, we have a number of medications and vaccines now that can fight against these viruses. Also, if the virus isn't able to spread to others because we're, practicing social distancing, wearing our masks, etc., then it's going to eventually die out because it needs a host to live. It can't just live on its own. And another thing to consider is that viruses don't actually want to kill us. We're their host. If we die, the virus dies because they can't live on their own. So ideally for the virus, what it wants is to make us sick so that we start sneezing and coughing so that it can spread more easily, but we recover so that it can continue living in us, and so that we can, we want to be sick it wants us to be sick for a long time so that it can spread for a longer time. Unfortunately, people do die from viruses because viruses aren't smart or anything. They're just doing whatever comes naturally to viruses, and so they don't know how to keep us from dying. Really, it's luck of the draw, and so we basically go through this fight with the virus, trying to balance it out as far as what's best for the virus, what's best for us, etc. In fact, the flu virus from 1918, most scientists believe that the reason why it ended, that whole pandemic ended, was because the flu mutated in such a way that it just became so much less deadly that it kind of became like the other flu viruses around, because there's a lot of different strains of flu back then and now. And so it basically just kind of went away, and not that it disappeared, but it just wasn't deadly enough, and so nobody really paid any more attention to it. History books will often tell you it's because we reached herd immunity, but that doesn't make sense with the information we have. That was 100 years ago, so we're not completely certain what happened back then. They didn't have the technology to differentiate the strains of flu, so it's only a theory, but based on what we do know, it's most likely that we did not reach herd immunity because only about a third of the people in the world ever had the 1918 flu. That's definitely not enough for herd immunity. There may have been a few isolated places that developed herd immunity, but the vast majority of the world did not. And so, the theory about this, where it just kind of mutated itself into unimportance, is the most likely scenario. This could happen with COVID-19, but we really don't want to wait for it to do that. We don't know how long it'll take because we cannot predict all these mutations. Mutations are random. It's basically just, if it happens, it happens, and it just picks it up if it's better for the virus. And so it could take, who knows, maybe a couple months, or it could take 20 years for it to mutate itself into unimportance. That's why we need to use vaccines and other things to get rid of it ourselves. Why are we seeing all these serious mutations right now? And how can we stop them? Well, first off, one of the big things about viruses is, kind of like I mentioned earlier, the longer they're able to go, the longer they're able to live, continue reproducing, etc., the higher chance there is for a beneficial mutation to show up. And if an immune system for a person is compromised, that means that they won't be able to beat the virus as quickly. That's why we need to protect the most vulnerable. It's not about, those of us who are healthy saying, oh, we're healthy, so it's fine. We want to not give it to other people, not just because it might kill them. The elderly are more easily susceptible as far as death and severe symptoms. But that's not even the biggest part, as terrible as that is. The worst part is that the virus can go unchecked in their systems for much longer, and so, without being beat down like with those that are healthy, and it'll end up mutating so much that it'll eventually come back and bite us, the ones that are younger, healthier, etc. Eventually it'll get to the point where we won't be able to keep it away either. We'll become vulnerable. So that's one possible cause of mutations. Another one is if we don't use medications appropriately. This happens all the time with bacteria. We try to use antibiotics to beat bacteria, but if someone doesn't actually finish their complete course of antibiotics, for example, say it's a 7-day course, and you stop after 3 days or 4 days because you're feeling better, there's a very large chance that the bacteria in your are still in your system. They're just in a weakened state. But as soon as you stop taking that, they'll continue to try and reproduce, and they might develop a mutation that makes them resistant to that antibiotic you were taking. So the same thing can happen to viruses. So if you've been able to get the first dose of vaccine, do not stop there. Make sure you get your second dose. We need both doses. We don't want to have this COVID-19 turn into an even worse virus than it is. One other big thing that's allowing these mutations to happen is the abundance of hosts. People are the host for this virus. We allow it to grow. The more people the virus can get to, the more likely it is to be able to grow and mutate and change. That's why lockdowns work. As much as we hate lockdowns, they really do work because they limit the movement of people and viruses, since the virus can't really move very far without us. Thankfully, we don't need to go into lockdowns in most cases. For the vast majority of places in the world, we're not at that point yet. We basically just need to follow the CDC guidelines, and it'll also stop the transmission, keep it from going to other people. And so it'll slow down those mutations, and we'll be able to stop the spread. In places where you're already in a lockdown, it's even more important to follow those CDC guidelines, because that means if you're in a lockdown, your spread has gotten out of control. So in summary, what's the main reason we're seeing all these mutations that are making SARS-CoV-2 more dangerous? Well, it's people not following the CDC and World Health Organization guidelines. If everyone would just wear a mask, wash their hands, watch their distance, stay away from large crowds, we would see COVID-19 cases drop dramatically. Deaths and everything else would drop dramatically along with it. To those who complain that the economy has suffered because of the CDC's and other public health officials' response to the pandemic, I would respectfully ask you to look in the mirror. Have your actions helped or hindered a return to normalcy? If you haven't been following the CDC guidelines, you've been hurting us all. And if you've been spreading baseless conspiracy theories, you've even been causing other people to hurt others. Please, don't do that. For the good of everyone, please stop hurting others. We need to work together on this. We can beat COVID-19. It's not invincible by any means. We've got tons of stuff we can do. It's just a matter of us actually doing it. So, anyways, thank you for watching the Plain English Public Health Weekly Report for January 8th, 2021. As always, I've got links below the video for the stuff that we talked about today and a bunch of stuff that we didn't get to. There was a lot of other stuff I wanted to get to, but we just don't have the time to do so. So please go ahead and check out those links. I'm Richard Greenland, and you have a healthy weekend.